opportunity of just dying in private. But what if it isn't cancer? You saw the scans. I did, and while they are concerning, there's a chance that the lesions are a benign finding of your subacute Burkieri syndrome. And we could do a biopsy to find out. My liver is teeming with lesions. A biopsy could cause bleeding, a stroke. It's dangerous. It's absurd. Why would you even recommend that? Because it's what Richard taught me to do. And I think it's what he would want. Richard's ears are burning. What's happening? I don't know. Is she having the stroke now? Well, come on. Y'all want to talk? Let's go talk. Stop funny. Take a spot. Yeah, I'm walking my sister's dog. Stop. You need therapy. Yeah, with Rula, getting help is easier than talking yourself out of it. The place you call home is important to you, so it's important to Allstate. Home is where you make all your best memories. Backyard campouts, early morning coffees. Oh, let's. Oh, there we are now. Because it's not just the home we protect, it's all the memories you make there. Nice work, you two. Buddy, do you? It's important that. It's the finding and parting. How's the patient doing? I have to take her up to surgery in a few minutes. Does that mean you have a minute to talk? You really should head back upstairs. I can't leave here until I know our whole story. I swear, I'm not trying to take advantage. I know your time is valuable. Does it really matter what happened? You seem happy. That doesn't mean I don't want answers. I told you, this was the most significant relationship in my entire life. I have no idea why it ended. I mean, wouldn't you want to know? You don't have any pictures of me because you deleted them all. I came home one night and you were crying on the floor. You had found out that I had cheated on you. We were young. The wedding was getting closer, and I kept thinking about how my mom wasn't going to be there. And it was a stupid, drunk mistake that I have regretted every single day since. I'm sure it was devastating at the time. But I'm okay now. You don't have anything to regret. I haven't even told you the worst part. After we fought, you got in the car. And an hour later, I got a call that you had been in a wreck. The accident. Yeah, well, that was nobody's fault. But if you hadn't been so upset. I stopped thinking that way a long time ago. I'm at peace with it. And I got to start over. Oh, what? More section, please. How's it going over there? Taking my final cut. Great. More touch. I'm gonna get a piece of that here and remove the last piece. We got the whole tool. Half open firm, but to my eyes, the markings look good. No. He's bleeding. Where? I can't see. Do you have anything on your side? Pretty. Well, could it be bleeding from the vessel feeding the tumor? Seems to be coming from normal tissue. Found it. Dr. Schmidt is correct. It's coming from an intercostal artery. Millen, I'm going to help you tie it off. Right angle and silk tie, please. Thank you. Got it? All right. Like this? Yeah. Just to make sure the knot is square. That's right. Okay. Well done. Now we celebrate. Great job, everybody. A sweater is an interesting question. Would you like to tell us the good news? flying a stat? She didn't seem bossy to me.
Laura and Megan used to make me pitch batting practice to them, and they would heckle me in very colorful language.
But she didn't expect to put her life in your hands.
Okay, let's get ready to inject the dye.
Okay. Damn it. Get me a balloon for dilation. Griffith, what do you see? Blood is coming from the stent. Correct. Quan, next steps?
You dilate the balloon to push the stent into the aortic wall.
Good job. Right. Inserting a balloon.
Jesus.
Balloon is in. Inflating the balloon. Good. All right, inject the dye. Next steps.
Rework, everyone.
Let's remove the sheet so Dr. Hunt can place the esophageal stent.
The surgery couldn't have gone better. Thank you. Cal's a great kid.
When he wakes up, I found a killer death fact for him. That was actually unintentional.
What's happening? Still training Shepherd.
Okay.
Oh, yeah.
Now that's what you call a birdie. I just like to state that if we played football, I would have wiped the floor with both of you.
I wouldn't be so sure.
Why don't you go return the car? Well, we still got some daylight. You want to go hit some on the driving range? What? You don't see how ridiculous it is that you're worried about losing steam in the operating room? You've got more focus and stamina than an intern. Look, golf is different. It's not that different. Both take endurance and concentration, that fire in your belly. But I made a mistake. Yeah, we all make mistakes. Not everybody is over 65. Yeah, I don't buy it. Don't get me wrong. It's good that you're taking stock. You're responsible not to. But where I stand, you're still going strong.
Why do they have to have peanut shells on the floor?
Do you want to go someplace else? There's a nice sushi restaurant across the street.
This is the one place where she won't think to look for me.
Would you like to discuss your options?
I understand my pros and cons. What I don't know is if I have the fortitude, the energy. My body is tired. And what you're asking, more surgery, another treatment.
Unless it's benign.
We know the odds of that are minuscule.
But they're not nothing. Catherine Fox. Well, I expected more from you. You have shattered every glass ceiling, beaten every odd, right? Why are you giving up?
You better watch your tone if you want your job back, Dr. Bailey.
Look, I find the job if I need to. You have so much to live.
Sometimes, depending on how small or big I do them, the shortest amount is 4 hours. The longest it's taking me is 9.
Maybe, or maybe not. But we
And
don't
this
know
one
unless you
feels like it's gonna be like a 6
if your patients have
to
beaten down.
7. Well,
Why them and not you?
cause I'm taking such tiny pieces and making such tiny twists.
What did they pay for the drinks?
Let's be real. Sometimes you
And I take
there's one thing you
nice
can count on. And
10,
that's the
15-minute
damn
breaks
good
in
food
between
that
too.
down.
For my shoulder
Catering.
and to rub my hands.
I'm glad you called, Megan, when you did. You were a lot sicker than anyone realized. We almost lost you.
Now you're going to make full recovery.
Thank you. My pleasure. It's Megan. Are you okay if I give her the update? Please, I owe her more.
Okay, let's order some croissant frappes. Thanks.
You really grew up to look like your dad.
I can't believe you remember. I mean, you must have been 6 or 7 when he died.
He put me on his shoulders once so I could reach the monkey bars. I never forgot it.
It's good seeing you.
I got here as fast as I could. What are
diffuse intrinsic pontine glioma, satellite lesions.
So he gets yearly full body scans. This was just missed.
It could have been too small to catch on his last one. I mean, this is a rapid growing malignant brain tumor. Soon it is going to start affecting all of his vital functions: breathing, blood pressure, heart. Is there anything we can do for him? Radiation, chemo? I mean, we could put him through radiation, but it'll give him maybe 2 agonizing months.
So it's a death sentence.
I'll go talk to Cal instead.
I'll do it. Yeah, I'll tell them. It's Nurse Karen's birthday. We tried a dozen different cakes for her wedding, and you wanted lemon. I think that was actually our biggest fight.
It never gets less weird. I mean, I just met you, but we also fought about cake 5 years ago.
Broken the space-time continuum.
Yeah. I see why I liked you.
Yeah.
Mm-hmm. You're funny. And you're smart. Yeah, and when you smile, your eyes do this sparkling thing.
No.
See? I mean, yeah, I didn't bring me cake. Even when you spend all day saving other people's lives. I have feelings about the memories that I've lost because, I mean, you can't miss something that you don't know happened in the first place. But I wish I remembered you.
My back is killing me.
Wow. I'm so sorry.
It's fine.
No, it's
It's fine.
It's been a long day, and then I like going on in my mind. And,
You're good. It's okay.
I should get back inside. But if you ever need anything,
I know where to find you.
how long do I have? It could be anywhere from weeks to months. That's it. I'm so sorry. Do you know that feeling when school's over, you're outside playing with all your friends, and it feels like summer could last forever? It's because our perception of time isn't fixed. 2 months could feel like 10 years, and 10 years can go by in a blink of an eye. Hey, we can cram a lot in a few months. I don't want to die. What do you want to do before you die? I've always wanted to go to space camp. Okay. Is it going? What else? I want to go see about McKinley. And read one of the names. That is literally one of my favorites too.
Oh, you come in under par? It's okay. And Dooku told me that you guys hit the links. Must be nice. Oh, I've just never had friends in high places.
That's not a line here. If that's what you're implying, I got a high absci score in my class.
Is that how it works? Get the highest score and then they take you golfing? Guess I should have studied more.
I have to hand it to Megan. She knew something was wrong and she pushed to make it right.
Yeah, give me the phone calls. You saved a life.
I'll be right back. Dr. Weber, I want Chief back.
Okay.
But I have a whole speech about why I deserve it.
Take the win, Altman.
I'll see you a little later. Shake and suck it. That poor kid. And less depressing news. I caught 2 interns kissing in the elevator. Oh, nice. Remember when we were interns and our futures felt so bright? Everything was possible. Well, pretty soon they're deciding something from me. And my department reassigned all of my cases while I was gone. I don't know what to do next. I do. Hi. I'd say welcome back, but I've been gone too.
We're not back.
We need your help. We're doing a procedure in the clinic. Can we have a scrub nurse? A scrub nurse in the clinic? Okay. Who's the attending? Oh, come on. I just got my job back. I know. I also know that I'm the one responsible for you losing it. And I would never ask you if this wasn't a matter of life and death. Okay. Don't make me regret it.
Hey. That was rough. You okay?
I thought that if I walled off the pain, that it wouldn't hurt. But there are some memories we probably wouldn't mind losing. The deaths, the breakups, the hard times. But nothing.
I'm catching up on things progress next.
What is gonna happen when we start repeating intern year, doing notes, changing bandages, and I get to operate?
This isn't a party. I don't want to be bailed out. That's why my family does it. But I want to be that person. I want to take responsibility for my mistakes.
But it is really about me. But memories, like neurons, work together to make you who you are. That's hey, you okay? If all we remembered were the good times. Oh, all right. Prepare to be vanquished.
I am going conditionally.
Our friendship's movie is strong.
Do we get out of the corner?
Okay.
And our loves wouldn't be as sweet.
Oh my love, a thousand kisses from you, and it's never too much. And I just don't want to stop. All I know when you say. A million days in your own bed, it's never too much. Take it all. I just don't wanna stop. Never too much, never too much, never too much.
So cling to the bad along with the good.
One day you'll be glad you did. A woman in Brownsville was ready to buy her first car with boom, just a debit card. But the salespeople laughed in her face. So she hit up Frost Bank, who instantly raised her limit, and bam! Wait. Bam what? Bam. She bought the car. She bought the flipping car. What a boss. Beep, beep, boss coming through. In 2023, a team of scientists studying hepatitis C made a fascinating discovery.
Complications include blood clots, bleeding, leaking from or blockage of the uterine tract, and studying the kidney transplant. I want to be ready.
You've been studying all night. You're probably upset.
No such thing. I went in early again. This doesn't have anything to do with that mystery woman who stayed in your bed and followed you around the hospital, does it?
Nope. Just trying to stay ahead. Whoever's ready can ride with me.
I'll come.
So,
They found that the virus creates a cellular mask to hide from our immune system in plain sight.
You said you want to do something to just the two of us. I was expecting something else. Like what? We've gone 4 blocks. No, I need oxygen. I need. Yeah, I needed that.
Camouflaged in molecules already known to our bodies, the virus copies itself over and over.
You're not hitting the gym this morning.
I thought I'd help you out of the clinic before my interview with Harry.
Oh, I've got some business at the hospital this morning.
Hey, we'll meet for lunch. Half a day at the cafeteria.
I don't feel like tacos.
You love tacos.
I'm damn busy for tacos.
It sneaks in like a Trojan horse past our immune system, and by the time the body realizes what's happened, the infection has already taken hold.
Why don't you just ask him?
If Weber doesn't want to assist on a kidney transplant, he doesn't want to assist on anything.
But you said it'll be interesting.
For the interns, not for Weber. What's this actually about?
I just thought it would be nice if the two of you worked together. I'm doing a liver biopsy on Catherine today. Her cancer may have spread.
And, he doesn't know, does he?
I tried to get her to tell him. She doesn't want to.
I can't believe you're doing this.
Breaking HIPAA?
No. Making me an accomplice.
What could go wrong?
What could go wrong?
You know, some people think you'll go to hell if you swipe left on a chaplain.
Oh, hey, I'm sorry. I was just trying to get to the news on there, and then my finger accidentally opened up that app. So, thank you. Someone's a little hungry.
I like to have extra treats to hand out to the nurses.
It's really kind.
Yeah, don't want to go to hell. Again, kidding.
In the morning. So then I switched that to Saturday at 2 p.m. and there was something else. Oh, I scheduled our OB appointment at Seattle Presbyterian.
Sure. Why take an elevator upstairs when you can cross town in traffic?
The minute people here find out that I'm pregnant, they'll treat me differently.
Like letting you sit down, giving you time to sleep?
No, like not giving me the good cases or thinking I'm not committed to the job. It's your call.
If I had a vagina, I'd want Karina DeLuca all over it.
You know, I mean, yeah. Hi. Oh, I'm sorry. This is the best that I could do. But hey, look at a new microscope. I've been using it to look for the bright side, but so far no luck. Well, I have put your name on a wait list for another lab. I don't know what I'll be doing there anyway. Meredith hasn't exactly filled me in on the next steps for our research. I have an idea to keep you busy today. Like we named glioblastoma on the thoracic spine. I can see that.
patient upstairs. If you want her case, it's yours. So were you hoping that I wouldn't notice she's 20 weeks pregnant? She needs to terminate that pregnancy before I can operate on that tumor. She wants to keep it, and 4 other neurosurgeons have turned her down. Will you just meet with her? Unless you're too busy.
Dr. Herrick, I've been warned.
Oh, Dr. Warren, the firefighter anesthesiologist, yes.
Yes, I know I'm a couple minutes early for my interview.
You're 4 hours early, and I have 2 lap coli. So I know that you're Dr. Bailey's husband, but I cannot shuffle my schedule around for you. I say no to Nepo, right? So 1 o'clock coffee cart. Yeah.
Okay.
Ready to see what today holds. That's why we're waiting here. Oh, great. Okay. Oh, Juan, I'm afraid I have some traumatic news. You are with home to the yard. Get it? Trauma.
I'm just happy for the working.
Dylan, any guesses where I'll see you? Please don't. That's right, the IPU. Okay. Okay, Griffith, you're with Weber. And Adam, different March's kidney transplant. Oh, I think that was March. Actually, Dr. March requested out. And Yasuda, you're a shepherd, unless you want to keep playing telephone. Shepherd, got it. Right. Let's get out there and. Yes. You okay? I'm fine. Can you pass me my tablet? I need to watch the weather report.
Now, man, you know you can't go outside.
I know, but I just want to see Victor Suarez. He's so handsome and he's always accurate. If he says it's gonna rain, it rains. I'm so sorry. I'm ready to head to stop at the Pt.2 for your pudding. You are forgiven.
Donna Mae Clarkson, 82, status post cabbage 2 months ago. History of TIA, congestive heart failure with an EF of 25% on Levophed and insulin drip and dialysis 3 times a week. And you don't have an advanced directive.
No, dear, but thank you.
If you can't make your own medical decisions with no advance directive, we have to assume that if you got sicker than you already are, you'd want us to use all available life-saving measures.
It could be very uncomfortable.
I understand. But if it means staying alive, I choose quantity over quality. Now, pass me that tablet.
You're so pretty. So pretty.
Good. What brings you here?
Patient consultation.
Oh, well, I was hoping you were here to see Catherine. She hasn't been acting like herself lately. She won't say it, but I think you're risking eating away at her.
I don't know what to say.
Oh, I know there are bad feelings, but if you can reach out to her, I'd be grateful.
I'll think about it. Nice of you to show up. Nice of you to tell your husband. Both of you play nice. The only enemy in here today is cancer.
Not both of you play nice. Both of you talking to him.
BP is 110/60. Okay. Do you have any tingling or numbness in your legs? No numbness. You just get weak. Miss Fletcher, this is Dr. Shepard. She is chief of our neurosurgery, and she's looked over your skin. Rhiannon, this is my brother Julian and his husband Carl. They have a vested interest. This is their baby. I'm their surrogate.
We have a vested interest because you're my sister.
He's lovable but annoyingly smothering, so you can just ignore him. They say you're here to tell me you can do the surgery without affecting the baby. Rhiannon, your pregnancy hormones have caused the tumor to grow more rapidly. Removing it will already be a challenge, but pregnant at 20 weeks, the risk is exponentially higher. The access to the tumor is limited, and there is a higher risk of bleeding and clots. What about waiting a few weeks until my OB can deliver the baby safely? It's possible, but it's not guaranteed. If you don't remove the tumor now, the pressure on your spinal cord could paralyze you, or the tumor could rupture, causing catastrophic bleeding. Your best option is to terminate.
Bree, you said we could adopt. You and I are adopted.
I want to do this. I'll do anything. I'll sign a waiver.
You won't. End of discussion.
3 different egg donors. 6 retrievals, 8 transfers between different surrogates, and the last embryo, the one that worked for you, is this one. So before immediately deciding what my best option would be,
Take another look.
Let's get some more scans. No promises. I'll take another look.
Thank you.
I am on your service and ready for anything. SWs, 20-car pileups, whatever you need. Just keep me busy and elbows deep in whatever you got.
Music to my ears. Ronald Monero. This is Dr. Kwan. Ronald broke 2 ribs.
Were you attacked?
Yeah, by my own ass and gravity. I'm recovering from hemorrhoid surgery. Slept getting out of the sitz bath.
Ronald needs incentive spirometer exercise 10 times every hour. Okay? Watch him and let me know the results.
Hey, boss.
Oh, Morris, you here with Meredith?
No, I'm here to do a kidney transplant. Thought you might want to assist.
Well, I think I'll pass. Oh, maybe one of our interns might get a kick out of it.
Well, listen, there's actually a groundbreaking angle to this one. Yeah, it's only been done one time before in the US. Come on, I'll walk you through the case, see if you change your mind.
I'm all ears.
Let's go.
What is taking so long? We don't exactly do a lot of liver biopsies in the clinic.
Oh, well. Thank you for protecting my privacy.
Richard is distracted for at least an hour. I had Nick invite him on to his kidney transplant. He knows to text me when they're done.
God.
You told Marsh?
Do you want to risk Richard walking in here? A lot about tacos. I don't know what that means, but gallbladder looks good. No fluid around the liver. There's a lesion here on the periphery. It looks like a.
This is taking forever.
Hey, now, Catherine, before we drape and prep you, sure you don't want to reconsider telling Richard?
I think I want to reconsider my surgical team. It's a biopsy, ladies. We'll tell Richard when there's something to tell. Y'all just get the damn thing started. Come on.
You requested me.
I know.
What you want me to do? Say, how my girlfriend wants that?
You know, I stayed up half the night studying for that surgery.
You should have.
Says the shepherd.
What?
I need to finish up Weber's notes.
If it were you would have taken it in a heartbeat.
Good. Change the plans. You and I are scrubbing in on a transplant with Dr. Marsh. Meet me in 001. Chop chop.
Is there another surgical option?
I don't see one.
Is that her diaphragm? Yeah, the pregnancy shifted her internal organs up, makes the tumor harder to access. What if you embolize the fetus to the tumor to stop it from growing? It's too late. Even though it's benign, the tumor is big enough to be a risk. There's no good alternative. Well, anyone who's gone to 4 different surgeons isn't looking for a second opinion. If we say no, she's just going to try to go to someone else.
Big day, how you feeling?
Anxious. I'm much happier serving at the war table than being on it. I'm a scrub nurse at Hope General. Are you not going to intubate him first?
No, today. Let me present
Tom Costello, 33, here for a kidney transplant without general anesthesia.
An awake surgery?
It was in the pre-op file under awake surgery.
Been given a mild sedative on the spinal anesthesia.
Okay, so what are the benefits of an awake surgery?
Foregoing traditional anesthesia can expedite recovery as well as reduce one's hospital stay, which ultimately could save the healthcare system billions.
As Griffin stated, I can keep an eye on my surgical team. If you prepare.
Dr. Adams, it's never the case, but I assure you he's a quick study.
Mm.
Okay, you ready?
Mhm.
How many break checks have you opened up?
10.
Go ahead. Okay. Wait. Are you sure everything has been sterilized well enough?
You got you. You can relax.
All right, here we go. Template. Thank you.
Still no advance directive?
And the more I go in there, I feel like a restaurant host is trying to free up a table. We're thinking we're trying to push a DNR on her.
I'm not. We just need to make sure she clearly understands what she's facing. Explain that life-saving measures can be invasive.
I used the word violent.
That's an understatement.
Well, no matter how old you are, no one likes to think about their own death. So give her a minute. Some patients just take a little longer to listen to their doctors.
I wonder if she would listen to someone else. Knock, knock. I don't know why I said knock, knock as opposed to just knocking.
That's okay.
It's a great office.
It's the chapel.
Right.
Hi,
Great.
He knows what it means.
We're here about a patient. It's an elderly woman. She has multiple comorbidities and she's refusing to sign a DNR. She has multiple surgical and medical interventions, and another intervention would probably do more harm than good.
So you're asking me to talk her into signing the DNR?
No, absolutely not. But chest compressions on an octogenarian with bones like toothpicks, it could kill her. At the very least, her ribs would snap and one puncture lung, and then we would have to intubate her.
Really, this is not what I do. My
My
arms. My dog when I die.
I think that she's struggling with mortality, and I thought that you might be able to help her understand her options.
Ah, la terrasse. You. Wow. La boxe. Le plaisir. Maison Perry, as seen on the terrace. He was considered the spiciest player in the league, but the world couldn't handle him. So I took all that spice and made the hot ones munchie meal with a sriracha curly fried burger or buffalo chicken tater melt. It's like a good kick in the mouth. Look at it. It's like a little time.
John, I just finished another session of spirometer exercises with Ronald and discharge Pt.2. Great. If you need me anywhere else, I can handle multiple cases.
Well, we have a scout back in bed one.
Yeah, I'll take a look. I've been interested in exploring trauma as a specialty, and I would love to work on bigger traumas.
Traumas are traumas. It doesn't matter if they're caused by gunshots or wildfires or falls in the bathtub. Ronald babysits his granddaughter every Tuesday, and he is a ping pong legend in Washington State. He wants to get back to both of those things as soon as possible. Carla in bed one, she split her head open sliding in a home plate. She's excited to play in the state semifinals next week. They're all counting on you to help them. But if they're not exciting enough for you, then
I'll go check on that.
I think that's a good idea.
No one can accuse you of having a dull career.
Well, I've tried to follow my heart.
And that's sweet. I'm more of a jack of all trades is great if you want a job at TaskRabbit, but for a surgeon,
I think you'll find that I'm a very good surgeon.
enthusiastically recommends himself.
In addition to my 4 years as a general surgery resident, I was a firefighter for 5 and an anesthesiologist for 7. When I set my mind to something, I master.
Right, but what happens when the next shiny object comes along? You're gonna leave me high and dry? Surgery, it's a calling. It requires patience, commitment, and stick-to-itiveness. If I may be frank, I'm not sure you have what it takes.
You want commitment? I've carried people down 10 flights of stairs wearing 75 pounds of gear. You want patience? I convinced a hopeless teen to step away from the ledge. Stick-to-itiveness. I've been happily married for 12 years, and I have 3 children that I love more than any career. So if you don't want to bring me back, I'll be fine. Thank you for your time.
Crazy as white lady.
You're saying you can do it? I'm saying I'll try. Because I think you are someone who doesn't like to hear no for an answer, and so am I. I told you. You wanted to give up. I told you it was possible. I didn't say that. I don't know if it is. This surgery will increase the risk to yourself, and we don't know that we can save the pregnancy. If there are any complications, I will put your life and health first.
I still don't feel good about this.
Don't either.
I wanted to. Okay. Dr. Yasuda will admit and prep you, and we will see you in the OR.
Okay, Catherine, I'm going in, so you may feel some pressure.
I'm good under pressure. And you better be too.
Good hemostasis. Put a rush on that and be discreet.
Oh, damn it. She's hemorrhaging. Okay, she's bleeding from her esophagus. Let's get her on her side.
Suction, hold on. Catherine, Nurse Linda, let's hang a unit of blood. I'm going to get the intubation tray. You're going to set up an EGD and let the IR suite know we are on our way.
All right, we need to put in a shunt.
This is more than a biopsy. And what are you saying?
I'm saying that even if we stop the bleeding, she could go into liver failure. She might never wake up from there. Richard needs to know.
Okay.
I don't know, you a furrow. Oh boy.
See what you got. Can we pause for a needle and sponge cap?
Okay, we already did one. We'll do another one before we quit.
Can't be too careful. Last month, a patient went septic after the surgeon slept a lump and had to gang her abdomen. Okay, new account.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We're good.
Great. Oh, shoot. Griffith?
Can you check the phone while Adam sutures? Sure.
Yeah.
It's Dr. Gray paging Dr. Weber.
Well, she does know I got pulled into a surgery. Well, I'll check in with her later.
It says 911.
You should go.
No much leave.
Look, I'm sure it can wait.
Please see the blood.
Richard, you need to go. It's your wife. Meredith is doing a procedure on her. You need to go. Where is she?
IR suite.
Just when you forget, you remember it.
Be better at this if I played the tuba instead of ping pong.
Besides, go. Okay, heart flipped over the median at GCS 7. He's intubated in the field. Vitals are unstable. We might have to take him directly up to the OR. Why? Trauma 1.
Okay, keep going, Ronald. I'll be right back.
Dr. Yasuda.
Orderlies are on their way to bring your sister to the OR.
Thanks, but that's not what I have. Do you have siblings?
I have 8.
I just have 3. When Carl and I first started looking for a surrogate, she insisted that no one take better care of the baby than Auntie Ree. I said no, but after all the failed attempts, she offered again, and she was so determined I didn't fight it. Then they found the tumor. And I'm gonna regret not fighting it now.
I don't really know, but Dr. Shepard and Dr. Altman are both excellent.
Aren't you a doctor? You must have an opinion.
I wish I could tell you it'll be fine, but I don't know. Sorry. We have 500 cc's of blood in the NG canister. Advancing the guide wire. I'm in the right hepatic vein, aim it anteriorly.
What happened?
We were doing a liver biopsy. She started bleeding.
Did you do Tip's procedure?
I'm about to put in the shunt.
Is she in liver failure?
Not yet. We're trying to prevent that. She wanted to get the results on the biopsy before she told you.
Take care of her. I'll be waiting outside.
Tom, we're almost done here.
Can we do a friend count?
Yep, you got it. Go ahead, okay.
I'm over here counting.
because it's in our heads.
Are you sure that the kidney is pink?
How many kidney transplants have you done? No, but I have seen so I've done more than 600. And I've had one done myself, so I get it's unnerving being on the table, but everything is under control, okay? We got you.
Okay.
Okay. It's good.
We're missing a ray tag. Let's count one more time.
Well, my faith is based on a belief that God doesn't abandon me in death, but which I personally find comforting.
Good for you.
Of course, everyone has their own relationship with death.
Mhm.
It's okay, perfectly natural.
Good for you.
Me, nothing, death, or hell, or coming back as a bird.
Well, we're not encouraging you to sign the DNR. We just want to make sure that you understand what not signing it would mean for you.
For the last time, I know what it means, and I know why I'm not signing it. I refuse to die before my bastard ex-husband. I'm gonna outlive that SOB if it's literally the last thing I do.
It seems like you could use some closure.
Hell yes! Closure on his casket before it clicks shut so I can dance on it.
I did not see this coming.
Understands. Things they don't teach you in divinity school.
They don't really teach it in medical school either. Ah, Victor Suarez.
Even on an antidepressant, there are days I feel stuck in my head. Depression symptoms like lack of interest and negative thoughts can hold me back. I wanted to break through.
Got a little hang time.
Adding Vraylar to an antidepressant significantly reduces overall depression symptoms better than an antidepressant alone. Not for elderly with dementia-related psychosis due to increased risk of death or stroke. Report changes in behavior or suicidal thoughts to your doctor. Antidepressants may increase these in those under 25. Report fever, stiff muscles, or confusion, which may be life-threatening, or uncontrolled muscle movements, which may not go away. High blood sugar may lead to coma or death. Weight gain and high cholesterol may occur. Difficulty moving, uncontrolled movements, tremors, feeling like you need to move, nausea, constipation, insomnia, dizziness, increased appetite, and fatigue are common. Side effects may not appear for weeks. Vraylar, breaking through to relief. Ask about Vraylar.
Margins look good. We've got proximal control. You see the suction? I've got distal control. We've lost neurosignal to the legs. We need to get more blood flow to her spinal cord, bolus her with 500 cc's of LR.
On it?
Anything? No, and we don't have time to wait for it to kick in. Start our pressors. They decel suppressors are decreasing blood flow to the baby. Still no signal. Go up with the pressors. Give the fluid a chance to work. Mom's life and health first. I know, it may take a few seconds. Rhiannon's spinal cord may not have a few seconds. If you don't stop, the baby will die. I am the primary surgeon on this. Stop! This is a human being on the table. She's someone's daughter, someone's sister. She's counting on us to save her, and ideally the baby. So stop arguing. Let's just run a science experiment. Just figure out which genes can do it. We've got blood flow to the spinal cord. T-cell stopped. Sinus rhythms back to normal. Thank God. Baby Suda. Yep. I'll see myself out.
See it? I just see it. Doesn't mean it's not still in here. Are you whispering? No, sorry, Tom. There's just a frog in my throat. Search everywhere. Search the floor. We get up close and we find it. At the table. Sir? You okay? Really not. I am trying to trust you. Not the sounds of the instruments when they hit the tray. I listen for the fucking kill. Yeah. Easy, that was the hang stuff. But the sponges don't make any sound. You do great. We're almost there. Hang on. That's the deep patient that I was telling you about. I was the one who was counting the lab pads, and I am always so careful. So if it could happen to me, it happens. Nobody's perfect. Deep breaths. Okay? That's a marsh. What? In the damn thing. That's a marsh. It's stuck. Your shoe. Thank you. Okay.
The anastomosis is complete. The 10 Raytex accounted for. We're ready to close. Dr. Griffith, why don't you take the lead?
Absolutely. Are you sure you don't want to do it yourself? Ah, sorry.
Reese and I met working in his father's furniture store. On slow days, we'd sit on the showroom couches laughing and talking.
That sounds nice.
Oh, it was. Then we got married, and everything went to hell. Our first fight was during the wedding, and it never stopped. The only good thing that came out of that relationship was my sleeper sofa.
Mrs. Clarkson, we have some news. We found your ex-husband.
Is he living with that rat, Sheila?
He was living at the Oceanfront Assisted Living Facility.
Oh.
But a couple of months ago, he passed away.
Donovan, how are you feeling?
Oh. I know it sounds crazy, but I'm gonna miss that horse's ass. Let's send that DNR now.
Are you holding on? Anybody next on you? At the fire academy, there was a burn building where they would simulate structure fires. It's our first time dealing with the heat, smoke, the gear. It's intense, pretty scary. It wasn't even the real thing. But the scariest part wasn't the fire. It was not being able to see my team through the smoke and chaos. And somehow there was nothing more terrifying than that that feeling of being alone. Is there a point in that story? I agree.
Did the biopsy go smoothly?
If by smoothly you mean having to convert to an EGD and TIPS procedure, then yes, it went very smoothly.
Did you hear from pathology yet?
Not yet. But for now, you're alive. And also, your husband is outside waiting to see you.
Told him.
It became more than just a biopsy.
I understand. Thank you.
I'm sorry, what?
Thank you, Dr. Bailey. I know I've been stubborn and very difficult, and you are a big part of what makes this hospital great, and you should always be here.
You giving me my job back?
Don't make me say it twice.
Oh, yes. Okay.
So she's gonna be okay?
She had some blood loss, but I was able to remove the tumor, and she and the baby are both okay.
Oh my God. She was right. She said you could do it, and she was right.
Thank you. I can't tell you how much this means to all of us.
We'll check on her in the morning.
I'm sorry if I seemed mistrustful earlier. I'm my older brother. I've always watched out for her, and I felt helpless.
I get it. My brother, he watched out for me too.
You looked me in the eye, and you lied.
I'm sorry. It was hard enough to get her to agree to do the biopsy. I'm sure you can relate.
How long have you known?
What does that have to do with anything?
Do you know how many times I've stood up for you? How many times I've defended you, Meredith?
I tried to get her to tell you.
And you don't think I would have been able to handle it?
I think she was scared.
That's exactly why you should have told me. Shame on you.
Not you.
Take the operating report and then check his H&H before you go.
You got it.
Good work today. So, you still thinking about going into trauma?
Yeah, I like the variety of patients.
Listen, some days are slower than others, but most days there is something interesting.
I don't know if I want to be the guy waiting around hoping for a car wreck. The man was in a medically induced coma with a brain bleed. His life will never be the same. His loved ones will never be the same.
Oh, and Robertson is going to take over post-op care. But if there are signs of early graft rejection, I want to know. Okay? Excellent work today.
Thanks.
I heard you repeating intern year. Yep. Yeah, 12 more months of following orders and barely getting an operate. Well, I don't think that's such a bad thing. Internships should be 2 years. 18 months minimum. We expect you to learn too much too fast. You're going to be more prepared. You don't think I'll lose ground? You want to keep leveling up. You work with people to make you better. Like Griffith. She's good. You stick with her, you'll be fine.
Congrats on Rhiannon. Such a victory.
Wow, it's a team effort.
You took the lead to say thanks. Thanks. So I was catching up on some admin work, and these are charts of 15 patients similar to Rhiannon, and they all asked to see you.
15 pregnant women with spinal tumors?
Patients with seemingly impossible cases who have been turned down at hospitals across the country. People who have only been told no.
You want to see me?
Well, they all say the same thing. They want the neurosurgeon who is working on the cure for Alzheimer's to take them on.
Impossible cases.
Well, until you get your hands on them. So think about it.
Hi. I was completely out of line in the OR. But I'm glad Rhiannon and the baby are okay, and really sorry.
Your outburst was inappropriate.
But you weren't wrong.
Dr. Altman, do you have a minute?
Sure.
Next playground. But how does it work? Here, take this, and just plug it in. You play by, well, moving. New games every month. One subscription unlocks everything. We're always adding new games, so your family's always moving.